Today I'm going to show you some of the ways that I check people's balance in the clinic every day. There's a test I use called the Berg balance test. It's a standardized test that physical therapists and other people use on a regular basis to assess people's balance. Hi, I'm Kathy and I'm a physical therapist, but if you're having trouble with your balance, you might want to check with your doctor and get a prescription for physical therapy. Sometimes it's best to have a professional assess how you're doing. The Berg balance test is a test that I use pretty much every day in the clinic because a lot of the people that I work with, they have a stroke or a head injury, something along those lines. So what I want to do is before we start treatment, we want to find out exactly where they are as far as the balance goes. So a lot of people that I work with, they come in and they're using a walker. And I want to see is like, number one, is the walker the best assistive device for them? Or if they come in with a cane, is the cane the best thing for them? And when I think of the best thing, I think of ease of mobility and safety. So I'm always looking to see what is going to be the safest so that we don't have any re injuries. Because usually by the time people get to me, maybe they've come in because they've had a fall, and after the fall, they were hospitalized. So, my number one priority is keeping people safe and getting them mobile again. So, the first thing I see is can they sit in the chair without leaning forward? And then I have them stand up. And as they're standing up, I'm looking to see is can they push up from the chair and stand up in one try? Do they need more than one try? Or can they stand up without even using their hands? Now, most people that I work with, when they come in, they have to use their hands to stand up. So that just gives me a data point. So if you can't stand up without using your hands, I'm not sure at this point if it's your balance or if it's your strength that's at issue. But, anyways, I've made a note of that. The next thing I do is I see can you stand for 2 full minutes without holding on? And can you do it safely? Are you wobbling back and forth if you're standing without holding on, or are you steady, strong, and stable? After that, the next thing I look to see is can you stand with your feet close together? So you want your feet one in front of the other. And can you stand like this for 1 minute safely? Now, for me, safely means you're steady. You're not, you know, wiggling all over the place. You're not reaching out to the side. You're not like this. You're standing tall with the feet together and you're confident with it. You're not feeling unsteady. You're not scaring me, quite frankly. And I'm not worried about you falling. Now, if I were testing you in the clinic and I wasn't sure, I would have a gait belt around you for safety, just so that I could make sure that I have something to hold on to. So if you're doing these at home and you're not sure where you are, go ahead and stand next to a chair or a counter or have someone nearby you just to make sure. So if you can stand for 1 minute with your feet together, then we would progress to the next balance exercise. There's other things in between, but the next one is can you stand with one foot in front of the other for 30 seconds? And when you do this, you have to be able to put your foot, the one in front of the other. You have to be able to do it confidently without holding on to get the full points. Now, on this test, you get different points for different abilities. So, for example, with this test, if you can get your feet in this position with me helping you and holding on, you get some points if your feet are just offset. So if you can do that for 15 seconds confidently and safely without holding on after you're in position, you get a point. If you can put your foot in front of the other, but not directly in front of the other, and you can do it without holding on, and you can do it safely for 30 seconds, you'll get more points. And then the final one is if you can put your feet directly one in front of the other without holding on confidently for 30 seconds, then you get the full 4 points on this. Now, if you're coming to see me, chances are you're not able to stand with your feet completely in tandem, one foot in front of the other, because I typically am working with people where that is going to be a goal later on to get their feet to be able to stand in tandem. For some people, sometimes that's not the goal. On this particular test, there's 56 points, and anytime you're under 45 out of 56, you're at a higher risk of falling. And so I always like to bump that score as close to 56 as possible. If you find this type of content helpful, please like and subscribe. Component of the test is if we have a small step and you want to be able to tap the step alternating right and left in less than 20 seconds. You need 8 taps in less than 20 seconds. So we're tapping the one foot, we're switching and tapping the other. And you have to be able to do it 8 times in less than 20 seconds in order to get full points on the test. I like this as a balance exercise because you're weight shifting, you have the chairs nearby, you have the counters nearby, and one of the functional things that people like to be able to do is get up and down the stairs. So this just kind of gives you that first part of going up and down the stairs. I hope you found this helpful. And remember, if you're having trouble with your balance, it's probably best to check with your local physical therapist to get a formal balance assessment. And if you did find this video helpful, you might also like this video here.